Avoid undergoing this procedure if you can. What procedure is this? It's a mastectomy. Why? Because the experts say so. Who are these experts and why do they say so? We'll answer these questions in this video, so stay with us. As a bonus, I will also provide 3 evidence-based reasons for avoiding mastectomy. As you would probably already know, a mastectomy, which is the surgical removal of the breast as part of breast cancer treatment, might result in an appearance which looks like this without reconstruction. Who are these experts who advise against mastectomy? I will refer to this recent article, which was published after the 2023 edition of the St. Gallen International Consensus Conference for the Primary Therapy of Breast Cancer. This treatment recommendation was agreed upon by a group of experts who formed the panel, with the authors listed in the article taking the lead. As we see, it is clearly stated that breast-conserving surgery is the surgical choice for the majority of breast cancer patients. This operation is usually followed by post-operative radiation therapy. This message of breast-conserving surgery being the surgical method of choice was reiterated in the 2025 edition of the St. Gallen International Breast Cancer Conference. However, in addition to encouraging the use of breast-conserving surgery, the experts now emphasize that unnecessary mastectomies must be avoided. There was variation in the clinical practice regionally, with about 20% of the expert panel reporting that 30% or more of their patients who were eligible for breast conservation underwent mastectomy. In line with the expert panel at the recent St. Gallen breast cancer conferences, I wish to give 3 evidence-based reasons why unnecessary mastectomies should be avoided. Firstly, and most importantly, breast-conserving surgery is not inferior to mastectomy in terms of overall survival. In fact, there is robust data to suggest that it may even confer better cure rates than mastectomy. A meta-analysis is a statistical calculation combining several studies in an attempt to generalize the data. The studies included have to fulfill certain stringent criteria. In this meta-analysis, having studied a combined total of more than 1,500,000 patients, the researchers concluded that overall survival is better in patients who undergo breast conservation therapy compared with mastectomy. The first reason to avoid mastectomy, therefore, is that it does not confer better survival and may actually result in poorer cure rates than breast conservation treatment. Next, surgical complications are always a concern. It affects the quality of life in the immediate postoperative period and potentially affects survival in certain patient groups. This study by a team of doctors in the United States analyzed patient outcomes from the National Surgical Quality Improvement Program database. They found that breast-conserving surgery, also referred to as BCS, partial mastectomy or lumpectomy, had fewer complications compared with mastectomy. Here we see the actual comparative percentages. Overall complication rate for partial mastectomy was 1.74%, while that for mastectomy was 4.04%. The odds of having post-operative complications after a mastectomy was 2.4 times higher than that for breast conservation treatment. In another study, also from the United States, where researchers evaluated postoperative outcomes comparing women who underwent breast conservation surgery with those who underwent mastectomy with implant reconstruction, it was found that the overall rate of complications for breast conservation surgery was 2.1%, but that for mastectomy with implant reconstruction was 5.5%. The likelihood or odds ratio of developing a postoperative complication was 2.8 times higher if a patient underwent mastectomy with reconstruction compared with breast conservation. One may ask if there were any consequences other than the inconvenience of having additional care to manage the postoperative complications. There is evidence to show that postoperative complications may have an impact on survival, as this team of researchers from Sweden and Norway found in this study. Corroborating the findings of their American counterparts, this group found that mastectomy has higher medical and surgical postoperative complication rates than breast-conserving surgery. Major medical postoperative complications increase significantly with age. Additionally, they found that postoperative complications are associated with worse survival after mastectomy. There is robust data to suggest that mastectomy is associated with a higher risk of postoperative complications, which in turn is associated with poorer survival. This is the second reason to avoid mastectomy. The third domain we will be exploring would be quality of life issues after breast conservation treatment and mastectomy. As mentioned earlier, a meta-analysis is a calculation combining several studies on a particular subject in an attempt to generalize the data. In this meta-analysis, done by a team of doctors from China, it was found that women who underwent breast-conserving surgery had higher body image scores and an enhanced quality of life. Similar findings were noted by this team of doctors from New England. They found that breast satisfaction and quality of life scores were higher for breast-conserving surgery compared with mastectomy with implant breast reconstruction. So women who undergo breast conservation treatment, as did this patient, are more likely to be able to have better quality of life and live more after treatment. In case it is not evident, this is her surgical scar, and this is the faint demarcation, indicating where she had radiotherapy. The third reason to avoid mastectomy, therefore, is that even with reconstruction, breast satisfaction and quality of life scores were poorer with mastectomy compared with breast conservation treatment. In summary, we have seen that experts who treat breast cancer gathered at a consensus conference have made an emphatic statement that breast conservation surgery, usually with radiotherapy, is the surgical treatment of choice for early-stage breast cancer, and that unnecessary mastectomies should be avoided. There are other specific details about these options, as well as when mastectomy may be appropriate, that will be discussed in our other videos. Nevertheless, we have presented the evidence supporting the fact that, when compared with breast conservation treatment, mastectomy results in poorer survival outcomes, higher complication rates, and poorer quality of life, all detrimental to breast cancer patients and survivorship. We hope that this will help women make a decision for their surgical treatment, which will help them live longer and live more. If you have found this information useful, please like, share, comment, and subscribe, or click in the link below for more details about the articles which we have discussed in this video. Thank you for watching. Until we meet in our next video with more evidence for data-driven surgical treatment decisions to benefit women with breast cancer, take care.